Hello. Hi. 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 It's nice to see you again. Hi, Finn. So Audrey and I were just discussing about all the things that have happened since I signed myself in, and all the medical issues that he's going through. Um, so based on the genetic testing that we've done in the past, we feel that duplication in chromosome 1 is likely the explanation for Finn's medical issues. The only problem is that we don't have a whole lot of information about other patients with a similar duplication. But the reason we think that that's the likely explanation is because the genetic content that is present in that region of chromosome 1 is really is high. We're talking about around more than 60 genes that are duplicated or extra. And so usually the impact of that type of genetic difference is having the medical difficulties that with different degrees of severity, right? That things dealing with. So I think is I think we can write a letter just stating that we think that that's the underlying genetic explanation, and with a letter like that, then you can use it to try to justify or support other services. Another idea is he also being seen in the comprehensive care clinic? Okay. Yeah, that's a great resource, and through them he can also um, get other services, right, for patients that require more support. Um, yeah. Now, regarding the muscular dystrophy concern, I'm not too concerned about that just because his CK levels have been within the normal range in the past. Uh, there are many different types of muscular dystrophies. The most common ones have been already ruled out because usually are detected with the chromosomal microarray, especially in boys, right? Um, I think if the neurologist, and I think you're seeing Dr. Nelson, right, in neurology. Yeah. Okay. Well, another idea could be if they have concerns about a muscular dystrophy, then probably the best way to just assess further is to involve their neuromuscular clinic as part of the neurology clinic. But from the genetics standpoint, I don't feel strongly about that, given that we have an alternative explanation with that duplication in chromosome 1. We have ruled out the most common forms with the microarray not showing, like, for example, the Duchenne muscular, the DMD gene being affected, which is usually because of deletion in chromosome X. Um, and and the CK levels have been normal in the past. That's why I don't think that's the case. Now, for Russell Silver syndrome, we did the molecular testing for that. That came back normal, and then because his growth has improved significantly in the past few months, he wouldn't qualify for that type of label. So that's why I think using that diagnosis of chromosome 1q duplication is probably it's what will serve him as a genetic explanation for a unifying diagnosis for the things that he's dealing with right now. Yeah, so the problem is, yeah, so these type of diagnoses are conditions that no matter what we do, they don't grow. That's what happens with patients that have Russell Silver syndrome. So the fact that the with the extra support, the J tube and all that, the feelings, he was able to grow. That is that goes against that type of diagnosis. Now, obviously, if we stop doing what we're doing, then probably he will go back to the same. But that's not. But that's just because the underlying problem, yeah, for his growth issues was that he was not getting enough nutrients or enough calories. Yeah. Yeah. Uh, well, uh, so you're asking if the hypotonia can cause crying. Mm-hmm. Well, right. Um, Yeah, well, it sounds more to me. So hypotonia doesn't cause pain. So when we have uh, weakness in our muscles, that is usually painless. It's just the muscles are weak. Um, the the sensitivity against touch um, sounds more like a sensory processing issue. Um, hmm? Right. That's what it sounds like, especially because um, it's very persistent, and and if you haven't noticed any other changes, um, like swelling, yeah, no, but I'm saying like for example swelling or redness in the area. Usually, the pain is tends to be a little bit more localized and generalized, um, and so if there are no other signs or symptoms associated with a localized process like swelling, inflammation, or things like that, then it's possibly that it's just a sensory processing abnormality. And I'm not saying that it is possible that what he feels is pain, but uh, yeah, and but that's not because there is a localized problem or a problem with the muscles. It's just that his brain is processing the stimuli, right, of touching or yeah, whatever triggers those reactions. The brain is processing it as it is painful, right? And that happens sometimes. It's really hard to treat, um, but um, but then in order to fix that type of issue, it'll be important to get the specific therapies that target sensory processing abnormalities. Um, I'm not. Yeah, I'm not sure if he's in the range for having night terrors or things like that. Not sure. Yeah, yeah, yeah. Uh, so I'm gonna ask our office to send you a letter explaining his genetic diagnosis, and and a copy will be uploaded to his records also, so you can use that to justify other services. And if you need anything else, just give us a call and let us know. Mhm. Yeah, no, please ask questions. It's, I mean, the limitation right now, with at least from the genetics standpoint, is that we lack that reference that sometimes we do have for other patients that are diagnosed with conditions that are more common, right? So, but hopefully in the near, yeah, yeah. But hopefully in the future we collect more information about other patients with similar duplications, and once we have the type of information, we're going to share it with you. Yeah, yeah, you're welcome. Is there anything else we can do for you today? Okay. All right. Okay. Well, I would like to see Finn back in a year. Um, Otherwise, just if anything happens in between and you want to discuss other things with us, just let us know and we can always expedite the appointment. Mhm. All right. All right. Have a nice day. Bye bye. Bye, Finn. Bye. Bye.